Excellent. So welcome everybody to our orientation for family attendees for the conference. We are so excited to see you here on Zoom and see all of you in person in Baltimore in just a couple of weeks. So my name's Amanda Johnson. I'm the executive director of the ARRE Foundation, which is the group that's organizing this conference, and excited to introduce you to some of the members of the research team who are also a big part of this conference and helping to make sure that for everybody who's coming in, we're making the most of this great gathering to gather additional data about ASXL related disorders in your kids. So I'm going to let everybody introduce themselves from the research team very briefly at the beginning, and then I will take over and talk a little bit about the conference itself, and then the second half of this orientation will be about research participation for those of you who are participating in research. So Dr. Ludwig, do you want to start by introducing yourself, and we'll just go down the line here?
Sure. Hi, everyone. I'm Natasha Ludwig. I'm a neuropsychologist at Kennedy Krieger Institute in Baltimore, which is where we're going to host the conference this year. We're really excited to be hosting and to meet you all. So I'll be talking a little bit about the research that we'll be doing in the second half of the call. So nice to meet you all.
Thank you. Dr. Russell?
Hi, I'm Bianca Russell. I'm a clinical geneticist at UCLA, and I've been working with the ASXL community since I was a medical student, so it's been really fun to see everything get to where it is today. Yeah, I'm talking a little bit more about some of the work we're doing, but I'm excited to see everyone in Baltimore.
Awesome. Dr. Wilson?
Hi, everybody. Good morning from the West Coast. My name is Rajitha Wilson. I'm a pediatric neurologist trained in neurodevelopmental disabilities. I work here at UCLA, close by to Dr. Russell. I have been a very proud member of the community since about 2022, so a little bit early into it, but feel like I've been really brought in depth and involved and have been really appreciative of all of you and the foundation and these other researchers on the call. And I'll be talking a little bit later in the call also about one of our studies here at UCLA and what we'll be doing at the conference along with Dr. Ludwig and Dr. Russell. Thank you.
Awesome. Thank you. So here's our agenda. I'm going to talk about the family conference itself, including the different meeting locations, what to expect on site, and some of the resources we'll have available for you, and other tips, things that we think might be helpful as you plan your trip and plan your time in Baltimore. And as I mentioned, the second half will be about what to expect for research participants, and then we'll have time at the end for Q&A. So I'm going to get started here. For those of you who are scholarship recipients, some of these slides are going to look familiar to you. Some of these are from the orientation we did for scholarship recipients. So this is a really high-level overview of the agenda for the family conference. You might remember that there's a second part of this meeting that's the ASXL Research Symposium for the research community on Thursday and Friday. And really the bulk of the programming for families begins Friday evening with our community celebration dinner. We have a lot of researchers who are sticking around from the symposium to meet many of you there. And then the programming for the family conference is all day Saturday and half a day Sunday. So if you're interested in diving a little bit deeper into the schedule, I will refer you to the website. All the detail is there. And I do have a printable agenda that we'll have up on the website very soon. It's a PDF that you can download and print, because I know what's on the website is informative, but not very print friendly if you like paper. So I'm going to talk about our two primary conference locations just to sort of orient you to where we're going to be in Baltimore. So we are going to be on the Kennedy Krieger and Johns Hopkins campus area, which is part of Baltimore. So the main building that conference programming is going to be in is called the Kennedy Krieger Institute Ashland Outpatient Center. The address is 1741 Ashland Avenue. And I mention that because if you Google and go into Google Maps or a mapping system and just look up Kennedy Krieger, there are multiple buildings. So I want to make sure you know which building is the right one that we're going to be in. And this is the location of all the educational programming, any of your research appointments except blood draws, the family lounge, and where you'll register and check in and get all of your packet, your badge, all of that sort of thing. That's all in this building, and that's the picture of this building here on the screen. When you do go into a Kennedy Krieger building, you do need to go through security. So I want to remind remind you that every adult in your group does need to have a photo ID. So we are going to provide a list of everybody who's registered to security. They'll check you off. They may or may not look at your ID, but please have it. And then after you check in with security your first time through the building, you'll have your conference badge, like a lanyard with your name tag on it and the conference logo. And that will be sort of your fast pass through the security process, any additional times you need to enter the building. So I do want to say, if you are planning to arrive at the building for the very first time on Saturday for family programming, there are going to be a lot of people coming that day. So just plan some additional time to get through the security process before the programming starts at 8:30. So I would say at least 8 o'clock or maybe even a little bit earlier if you haven't already been through the security check-in process at that point. The other location is about a block and a half walk away at the Residence Inn Baltimore at the Johns Hopkins Medical Campus. And again, we're using the full name of the building because there are multiple Residence Inns within the city of Baltimore. So the address is 800 North Wolf Street. So again, just check your locations and make sure you're headed to the right location. And this is where we'll be hosting both dinners on Friday and Saturday night. And then if you are participating in biological sample collection, so having your blood drawn for research, that is also at the hotel on Friday. So this is just a Google satellite image of the two different spaces so you can sort of see how far apart they are. It is a flat walk on sidewalks between the two locations. We will have signs, little yard signs with the ARRE Foundation logo on it to help you find your way between the two locations. And we'll just say, watch for signs. There is a different location where you need to enter the building on the weekends versus the weekdays. I'm not going to give you all that detail now because we will put it in multiple communications to you by email, and we'll have people to help direct you. So just watch for signs. That's my takeaway for you as you try to find your way between these two locations. So we will be in the Arnold J. Kaput Conference Center on the 8th floor of the building at Kennedy Krieger Institute. This is a couple of pictures of the space. So this is where conference registration will be, here in the foyer that's pictured. You'll check in for your research, do all your research related sort of paperwork that you need to do in this foyer area as well. The main conference room is here. And then this is also where the family lounge will be. And there's one of the bathrooms on this floor has an accessible changing station. And then there's a bank of sort of traditional restrooms as well. So the 8th floor is really the hub of conference activity at Kennedy Krieger Institute. So when you come to check in, I just want to cover a couple of things to sort of give you a preview for what we're going to ask you to do. So you'll come to our check-in desk. You will get from the ARRE Foundation your conference packet, which will have a copy of the agenda, additional paperwork. We have ribbons for participants to go on your badge. You'll get the actual badge holder and your lanyard there. You'll be able to pick up some other swag, including your conference t-shirt. I'm wearing these are our new volunteer and staff t-shirts that came yesterday. So I'm wearing mine today. And attendees will have a different shirt. It's a different color. You'll sign a liability waiver and photo release for everybody in your family. We'll have you complete a demographic survey, which is important for us to collect because it helps us have some additional data for applying for future grants for this programming in the future. So we'll ask you to fill that out. And then if you are participating in research, after you finish with us, with the ARRE Foundation check-in, you'll step over to the research help desk and you'll have some additional steps to go through, which I think the research team is going to talk about a little bit later. So if you are arriving before Saturday, and we'll be on site, the registration hours are listed here. So 8 to 5, Thursday and Friday, and Saturday starting at 7:30. I encourage you to come and get your materials, go through security, get your badge, and that will help expedite the process for everybody when the bulk of the programming starts on Saturday. So next, I'm just going to cover a couple of the spaces that we have for family comfort and some of the accessibility features. We will have a family lounge. That's what's pictured here on the screen. This is directly across from the main conference room. So in this space, there will be some sensory toys. We have floor mats, activities and crafts. We have visits coming from the National Aquarium and Port Discovery Museum coming with some outreach programs. This is really intended to just sort of be a sibling hangout space. If you've got a caregiver who's in education, the other caregiver can be in the space with your kids or siblings. But do want to note there is no supervised care provided. So a parent or other responsible adult needs to be supervising your kids at all times in this space. And the hours are listed here on the screen. We will also have additional detail published on the website about this space, including the hours that the National Aquarium will be there on Friday and when Port Discovery will be there on Saturday. And we're still working on some other potential visitors in that space, but the website and subsequent emails will have the updated schedule for this space there. So also on the 8th floor, as I mentioned, there's a family restroom with a universal changing table as well as traditional restrooms. Because this family restroom is going to be so heavily utilized, we'll just ask that everybody only use this bathroom with the universal changing table if you really need it. And if not, please use the other restrooms. And we will also have signage directing you to accessible restrooms on other floors if that bathroom is occupied. Also on that space, we'll have a designated quiet room if people need to take sensory breaks, and there's a lactation room on that floor as well. Kennedy Krieger also has a really nice therapy garden that you can access through an adjacent building. And so we will have the hours of availability that you'll be able to get to that therapy garden posted on the website soon. You have to go sort of a tricky way to sort of get there and have to go through security again. So it's not the easiest place to access, but we will have access to it. And so we're working on getting everybody directions and the hours that you'll be able to access that. So it's a nice way to get some outside time if you're feeling a little cooped up. And did want to note sort of what the plan is for medical care if you or your child needs that urgently. So if it's a true medical emergency, call 911. If you need to walk into the emergency department, the Johns Hopkins Hospital is about half a mile from both the conference locations, so it is walkable. If you needed to walk there, it's about a 10-minute walk. On the conference website, there is a link to a PDF that has a map of the hospital complex, including where the entrance to the emergency department is. So I know all of you rare parents are very good planners, so I'll encourage you to go to that page and take a look at that map, and just so you know where it is. So if you do have an emergency and end up going to the emergency room, so after you or your child is under the care of a medical team, there is a number that you can text. It goes to me and several other of our staff and volunteers, and we could try to help coordinate an additional consultation from experts if needed. But just want to note that the phone number is not monitored 24/7. This is really like if you just need some additional backup help connecting to resources, we can try to do that. And you can try to reach several of us through that phone number. So this is a really high-level overview of the different education sessions that will be happening at the conference for families on Saturday and Sunday. Again, the full detail, including sort of the objectives for each of those sessions and additional detail about each of the speakers is here as on the website as well. The first session is sort of the conference opening. Dr. Ludwig and Dr. Russell will be co-presenting about how the ASXL community is getting ready for clinical trials. The next two sessions are a panel that includes a medical professional and two parents sharing their experiences on incorporating complex and palliative care into your care team, and then managing sleep disturbances. And then in the afternoon is our family focus groups, which I will touch on briefly on the next slide, and then there's a lot more detail coming in the research section of this meeting. And then on Sunday, 4 additional presentations about different areas of care, starting with what we know about the ASXL genes and what we don't. And that will actually be a co-presentation by our new Chief Scientific Officer, Dr. David Batoon, and Dr. Stephanie Bayless. And again, the printable agenda is coming on the website with all this detail in a nice printable format for you. So as I mentioned, Saturday afternoon from 12 to 5 are family focus groups. You will not be in a focus group from 12 to 5. You will be assigned to blocks of time within that 5-hour section. And we'll talk about this a little bit more in depth in a couple of minutes here. But the purpose of this slide is just to tell you to please watch for your assigned focus group. So we will communicate that with you by email prior to the conference. It will also be on a sticker on the back of your badge, and will also be included in the materials that you pick up when you register. And so These are focus groups. You'll be in a group, someone in your family will be in a group with one of the 3 focus areas. So GI-related issues, neurodevelopment, or behavioral dysregulation. So watch for your assignment, and please let us know if you have any questions once you get your assignment. I'm going to cover really briefly just meals and food options for conference registrants. So we will provide, as part of the program, lunch, coffee breaks, and snacks on Saturday. If you are staying at the Residence Inn, breakfast is included. So you can have breakfast at the hotel. That starts at 6:30. We also have additional add-on dinners as part of your conference registration, including the dinner on Friday night and the dinner on Saturday night as well. And I think just about everybody who's registered for the conference is also registered for those 2 events as well. So we'll have lots of folks there. There are other nearby options for food if you're there, earlier in the program or earlier in the week. There is a cafe in the adjacent building to the main area where we'll be in the conference center called the Nook. It's open weekdays until 2 p.m. There's a Starbucks nearby. The hotel restaurant is open as well. And there's also the cafeteria at Johns Hopkins Hospital. So we're still working on getting some additional information up on the website, but just generally speaking, there's other food options within a walking radius of where we'll be. Parking, I'm not going to go into a lot of detail here. It's very, there are some specific details based on your specific situation. So I will refer you to the website where we have some additional information coming, should be posted by the end of the day today. You can park at Kennedy Krieger Institute at an hourly rate, but do want to call attention that there's no parking attendant after 6 p.m. So you have to pay at security before you leave. So it's not a totally smooth logistical process to get out of that garage, but it is possible. And then there's also parking, both overnight and daytime parking at the hotel. If you are staying in our room block, you booked it within our room block and you're staying there, please make sure that you are getting the $32 a night rate at the hotel. That's guaranteed. And if you don't have that, let me know and we'll fix that. But and then if you're not staying within our room block, the regular rate is $42. And then the daytime parking rate is $15. So where to find additional information? The conference website has it all. Everything we know is on the website as of this moment, and we're perpetually adding to it. The foundation will also be sending email messages to you as well as registrants. So please pay attention to those. We put a lot of time and effort into those and making sure that's a good way to get you as much information as we can. So you'll get one at least one more a week out, potentially another one in the next couple of weeks. And then there will be daily morning messages in your inbox Thursday through Sunday with any sort of late breaking announcements, things we need to call your attention to. So please plan to check that email when you get up in the morning while you're at the conference. And then we also just created a private Facebook group for conference attendees. I will put the link in the chat if you're not already in that group in just a few minutes here. So this has been a great way that we can sort of post updates in real time as we have them, call your attention to other things. And there's some nice conversation going on in that group as parents are introducing themselves to each other, so you can start to connect with other families before you even get to Baltimore. And then if you're still stumped, if you can't find it on the website, you can't find it in an email, and you can't find it in the Facebook group, you can email info@arrefoundation.org and someone will get back to you, or you can call or text that number and we can get back to you there as well. So that's it for my slides. And I think I'm going to turn it over to Dr. Ludwig to share her screen and take over on research orientation.
Great. Thanks so much, Amanda. That was really helpful. So I'm just going to share my screen. And Dr. Russell and Dr. Wilson, I'll just drive our slides for us. Great. All right, can you all see? Okay, great. So Dr. Russell and Dr. Wilson and I are excited to talk to you guys about the different research opportunities at the conference and give you some orientation around those studies. So the first thing I want to talk about is actually a study for caregivers, which Amanda just mentioned, the Family Focus Group study. So this is actually a study that we received funding from the Patient-Centered Outcomes Research Institute, or PCORI. And PCORI has funded us to gather some more information about neurodevelopmental difficulties, problem behaviors, and gastrointestinal symptoms across the 3 ASXL related disorders. And this is because you may remember in 2022, right, Amanda, there was a survey sent out to families to ask about kind of treatment priorities or symptom priorities. And these were the 3 areas that sort of rose to the top across the 3 disorders. And so we want to learn a little bit more about what is the lived experience, of these symptoms, and to get some more information about, how they impact the child's life and how they impact family life. This kind of information is really important to understand the disorder, and then also in the development of new treatments. So we're really excited that we have some funding to conduct this research study at the conference. So these family focus groups are going to happen on Friday and Saturday afternoon. There's not going to be any conference programming during these times, so you won't miss anything. But you'll be scheduled for slots, and will be emailed your schedule before the conference, as Amanda mentioned. And we hope you participate in all 3 focus groups. Each one is about an hour, but participation is totally voluntary. This is the schedule. Amanda, do you want to talk about this?
Yes, this is my logistical nightmare that I'm currently living in. But so we have different focus groups. So if you are ASXL1 or ASXL3 family member and you are arriving Thursday or Friday morning, and we know that, you may be scheduled for a focus group on Friday afternoon. Otherwise, you will be scheduled for focus groups on Saturday. So for ASXL1 and ASXL3, those communities will be broken up into 2 groups because we have so many attendees. And then ASXL2, there's only one ASXL2 group. So there's not really a whole lot you need to know about this at this point until you get your schedule, but you will be scheduled for one of each of these 3 groups, most likely on Saturday, but potentially on Friday.
Great. So as I mentioned, participation is voluntary. We are making this open to all families. When you check into registration for the conference, you will, if you want to participate in these focus groups, you'll sign a consent form and complete a pre-focus group demographic survey, just so we know who is participating in these focus groups. We ask that only 1 caregiver per family participate. So if you have more than 1 caregiver coming to the conference, the other caregiver could potentially be with your child and be in the family lounge, or go back to the hotel, take a break, do whatever really you want. If there's only 1 caregiver coming to the conference, then the child can be in the same room as the focus groups, if that's okay with you, and if they have like a quiet activity that wouldn't be disruptive. But there's also, if this is too challenging, then there's no pressure. Like you don't have to participate in the focus groups. Again, it's totally voluntary. So, and we will have sufficient participation. So no need to feel bad if you're in that situation and just, it will be too challenging to attend.
Natasha, if family members are coming without their children, can they also participate?
Yep. Yes, so any caregiver can participate, but again, it would just be 1 caregiver per family. Yeah. Any other questions about that?
I have a quick question.
Sure.
With this is Justin Winky here. With the focus groups, are you looking for the caregivers participating in those to be the ones with the most in-depth or hands-on knowledge with those issues, or is it you're more or less getting subjective histories and strategies from participants, or what conversation is taking place?
Mm-hmm. Yeah, I mean, it's really, I think the first most important thing is whatever is most convenient and feasible for your family in terms of who participates in the focus groups. That's number 1. And number 2 would be, sure, I think, if it doesn't really matter, then I guess the person who may have most experience in those areas in caring for the child. We're just going to be asking kind of open-ended questions about kind of, when we mention, neurodevelopment, or when we mention problem behavior or GI symptoms, what are those symptoms? You know, like what does that look like, and how does that impact daily life? What's great is that you'll actually be everyone coming to the conference will be emailed a list of the questions that we're going to be asking during the focus groups, just to give you a week's up, heads up about what the conversation will look like. So, and then you'll also get that again in printed form at conference registration. So you'll be able to take a look at it and maybe make a decision then about, who might be the best fit to participate in the focus group. Any other questions or thoughts?
So what if the second, like, let's say there are two caregivers, and if this one person would be active and the second one would just listen in, like no participation, but just for listening in, is that even possible or no?
That's a great question. I think it probably would be preferred that they weren't listening in. And that's because everybody who participates, it's sort of like confidential who participates. And so we want to kind of maintain that as much as possible for research purposes. So I think there's going to be kind of other activities in that family lounge area that families can, engage in. So I think that's when Port Discovery is coming, right, Amanda? And the aquarium is coming also during those times. So there'll be activities to do kind of in that family lounge area. Any other thoughts about that, Amanda, or anybody else on the research team? We
So
will.
it's like if two parents participate, mom and dad, it's only one person, like either mom or dad.
Yeah, exactly. So we'll only have one caregiver actually participate and be in the room during those focus groups. We will be, of course, we're recording everything, right? So we're going to be transcribing everything that's said, and we're going to be kind of putting together that data and analyzing it. And we will definitely share the results back with the community so that you can learn about what was discussed at those meetings.
Okay.
If you have any other questions, though, feel free to email Amanda, and we can get those questions answered for you about the PCORI participation. Okay.
Yeah, thank you.
Okay. Okay, so now we're going to shift to talk a little bit about the studies for individuals with ASXL related disorders. And so Bianca, I think that the first few slides are yours, so I'll let you take it away.
Perfect. Okay, so this is a little bit of a zoomed out view of some of the studies that will be collecting information on your children at the conference. And so again, just like all these things, these are optional. But if you are involved in this, it is something you have to enroll in before the conference. So unlike what Natasha just discussed, where you can kind of walk in and choose to participate, this requires enrollment beforehand. So I think at this time we've pretty well closed that. Julia, are we still open? We've sort of passed our deadline, right?
If somebody was interested and could get me things very fast, I could work with that. But generally,
Okay.
have a long list going.
So this is your last call, okay? But for those who are involved already, thank you for the work you've done so far. But this is just a big overview of how the studies are organized. So at the top, we have the UCLA ASXL Natural History Study. It was formerly the registry, and we've sort of rebranded it and really expanded and grown it in the last year or so, have put a name to it that makes more sense to our goals and is better description of what the study is. And that is something long-term that not just at the conference, families can be involved with at all times. It is open to all ages. Then we also have the biobank, the REACH biobank, which is also housed at UCLA, which holds our biologic samples, so our blood and in some cases skin tissue for participants, and that's open to all ages as well. And then Dr. Ludwig has the ALP study, which she's going to talk a bit about, but is some deeper neurodevelopmental assessments that are under the umbrella of the natural history study. And then also Dr. Wilson's going to talk about the champion study, which is also looking more at sort of the neurologic and motor side of things. And her study also feeds into our natural history study. And that's open to individuals age 1 to 5. And she'll go over that in detail. But the bottom line here is that we've got sort of 4 different studies that are all together and all link up so that the data can be shared and so that we have a place to store these long term, so we can continue to grow the information over time. Okay, and so here's a little bit more about the natural history study. It's a long-term study to understand medical histories of individuals with ASXL related disorders. We collect information through surveys, things like medical history. We can review medical records, genetic testing, labs, imaging, and clinic notes or hospital notes. It also involves clinical assessments like neurologic exams, and we can collect new data as well, like EEGs, neurodevelopmental testing, and gait mapping, which are some of the elements that Drs. Ludwig and Wilson are going to talk about. So to join the natural history study, it initially requires a medical review of your child's genetic testing, and then a phone call with our research coordinator, Julia and Wendy, and then we send you a DocuSign consent form that you complete and send back to us via email. And there's our contact information there at the bottom. Any questions about the natural history study? Okay, perfect. Next slide. So pretty well matched up with the natural history study, but it's technically under its own protocol is the REACH biobank. And excuse me, REACH stands for Rare Epigenetic and Chromatin Disorders. And in this study, we collect blood samples, and basic science researchers have access to those samples to better understand the ASXL related disorders. The samples are stored at UCLA, but they're available to qualified researchers. So it's really intended to be a repository where we store this information and create a research tool that researchers who want to understand more about ASXL conditions can contact us and have access to those. This is a really strong association with Dr. Valerie Arboleta, who will be speaking at the conference as well. And she's my counterpart in the lab. So I do the clinical side and she does the lab side. So it's her lab that collects and processes all these samples, stores them, and is doing research on them themselves, but also sharing them with other researchers. So to join the biobank, you have to be enrolled in the natural history study because that's the part where we assess the genetic testing and make sure that we have all of your information. And then there's a DocuSign consent form, similar process that gets sent to your email and you send back to us. We typically collect 3 tubes of blood per person. In some cases, we do include parents and or siblings. In this situation, some families have reached out and asked, and we've let you know whether or not we wanted to get samples from parents or siblings. And so there may be some situations where that happens, but at the conference, our main goal is to get samples on those with ASXL conditions. And we're looking to collect quite a few samples. So that's our main goal. So we may, if you ask, we may still say, you know, we're just going to collect your child's blood sample. Something that has come up is that families have reached out and said, we've donated in the past. Do you want more, or why do you want more? And the answer is we do. If you're willing to donate again, we are interested in looking at how things change over time in your child's blood sample. And also there are situations where we've used a sample for a research study and we need to sort of replenish that supply. So it's certainly kind of a bit case by case because our priority is going to those that are new sample collections for us. But please do reach out if you have donated in the past and are interested in donating again. We'd be very excited to get more samples if we're able to. And I think as Amanda has sort of mentioned, all the sample collection is by appointment only on Friday, and that will be done at the hotel, not at the Kennedy Krieger. And so if you're involved in this part of the study, Julia will have been in touch with you about the logistics on that end. Any questions about the biobank? All right, Natasha, I think you're back on.
Yep, thank you. Okay, so I'm going to tell you a little bit about the ASXL Behavioral Phenotyping Study, or ALPS for short. Thanks, Amanda, for the beautiful logo. This study is a study that I'm leading, and it is part of the UCLA registry. So all of the data we collect will go back into the UCLA registry for storage, and then also so we can kind of compare data across the different studies that are going into the registry. The coordinator for this study, her name is Rachel Northrup, who's here on the call. And this is for really anyone with a confirmed pathogenic ASXL related disorder of any age, which is great. So this term behavioral phenotyping might be new for some folks. So I thought that maybe we could talk a little bit about what that really means. So a behavioral phenotype is essentially the characteristic cognitive, functional, behavioral, and psychiatric pattern that's typical in a disorder. So in this case, would be typical in an ASXL related disorder. And behavioral phenotyping is essentially collecting the information about the behavioral phenotype. And so that's really what this study is focused on. Behavioral phenotyping can be one aspect of a natural history study, just like it is for in this case, and it can help us learn about genotype-phenotype relationships. So with specific variants, what do we typically see in terms of the neurodevelopmental profile and the behavioral profile? What aspects of neurodevelopment and behavior are part of the disorder and may be important to target for treatment? And then also the best measures to use in clinical trials. So really the ALPS study is focused on kind of neurodevelopmental outcomes and kind of behavioral outcomes. So there's actually 3 parts to this study. Part A is going to be happening in person, and so that primarily will be at the conference. For any local families, we can talk about, you coming back to participate at Kennedy Krieger at a later time, but most people are going to be participating at the conference. And so there's 4 different visits that will happen across the days of the conference. So the first session is a session looking at kind of cognition and communication abilities. So this is about 3 hours, but it sounds like a long time, but we're definitely going to take breaks as needed. And we'll have lots of kind of downtime within that. The cognitive and communication session is also kind of like a play-based session. Okay, so there's going to be different games and puzzle activities, or the examiner may show the individual different objects like a ball or a cup, for example. We may be looking at kind of how they're manipulating those things, if they can do that. So we're looking at how their thinking skills, and also how they're understanding language, and how they're communicating as well. The next session is a neurological exam and motor assessments, which are actually going to be done by Dr. Wilson, which she'll talk about in a minute. And so we're kind of sharing data across the Champion and the ALPS study and putting it into the registry. The next session will be about an hour, and it's looking at autism symptoms. So this is really a play-based and interview session depending on functioning level. And then we're going to have a 1-hour vision assessment, which is not like an ophthalmology kind of assessment or an optometry visit. This is more about looking at how an individual is using their vision in a functional manner. Okay. So those are the visits that are going to happen at the conference. It sounds like a lot, but we're going to meet with every family prior to the conference. Some of you we've met with already. Some of you we will meet with you and talk with you more about what this is going to look like and what makes the most sense for your child in terms of time of day that might be best, and different ways that we can support their participation and just kind of general happiness, during these sessions. Part B of this study is a remote caregiver interview. So there's 2 parts to it, and they can both occur at the same time, or we can split them up if you prefer. The child's not needed for this. This is going to happen after the conference. And part of it is getting a sense of kind of how does the individual function on their own through the day, and what kind of supports they need to function through the day. And the other part of that is get a better understanding of challenging behaviors. Part C of ALP study is a series of caregiver questionnaires. So some of these will be paper, which we'll give you at the conference, and some will be web-based, which we'll send you an email for completion. And we're going to ask about a range of symptoms and impressions and experiences through these questionnaires. Again, this sounds like a lot, but again, we'll meet with every family prior to the conference to talk more about this and answer any questions that you may have about participation for your individual child and family. For any of the standardized assessments that we do, where we have kind of an understanding of what typical development looks like, we'll be able to give you a report with some scores that you can take back and give to your primary care physician, your child's primary care physician, or their educational team. This isn't going to be a clinical assessment though, so we're not going to provide information about diagnoses or anything like that. It's more going to be just a kind of a list of scores so that your medical or educational team can potentially utilize. They may find that helpful in terms of what services they provide for your child. Oh, before I move on, we move on to Champion. Any general questions about the ALP study?
Are you still enrolling new participants in the ALP study, or is that closed?
We can still enroll in the ALP study, and if you are enrolled in the natural history study with me recently with our new consent documents that allow for in-person assessments, you're eligible to be a part of that, and we'll send you a scheduling survey to get some more information about when you'll be there, and then Rachel and Dr. Ludwig will reach out to you for scheduling purposes.
Thank you.
Great. So if there's no more questions right now, I'm going to pass it on to Dr. Wilson.
All right. Hello again, everyone. So I'll talk a little bit about the Champion study, but for some background, some of you might be familiar with at the last conference in 2022 at UCLA, we were able to do what we call kind of like a preliminary pilot study, although we got some really good data. So it almost wasn't like a pilot study, some really nice data with a focus around motor, right? It was called the kind of gait and movement study. And we came to the conference and we did neurological examinations across all ages on those with ASXL related disorders. We got some questionnaires around motor functioning, parental questionnaires, some medical history, and then we did what we call the gait mat, which I'll talk a little bit more about here. And we published on that data, and really kind of the lens of our lab is around motor function, or more specifically, motor challenges or motor differences that are really prevalent, really common in individuals with what we often call genetic syndromes and neurodevelopmental conditions, or genetic neurodevelopmental conditions. And we know, both from our own research, from my clinical work, from other studies, that these motor difficulties often impact lots of other areas of development: language, social communication, cognitive abilities, interaction with caregivers, adaptive function. So although kind of our focus is on the motor domain, obviously motor function is tied to many other areas of development, which is why we don't just measure motor function, we measure some of these other areas that Dr. Ludwig has described as well. And so from that early data, and as a part of a larger study to understand chromatin modifying conditions, or chromatinopathies we call in general, we have a study funded by the Simons Foundation, the Simons Foundation Autism Research Initiative, where we're able to enroll additional individuals with ASXL-related disorders and do more deeper phenotyping or behavioral phenotyping like Dr. Ludwig went through. And some of our data from last summer informed some of that we really did find pretty prevalent motor difficulties. We found that they related to other behavioral abilities, but we also found that some of the measures we were using aren't capturing it to the degree that we want it to be. And so part of that informed this study. One of the reasons why we're focused on that 1 to 5 years of age range is to really understand what's happening in earlier life, in earlier development. just because it's during that period of time that often what we describe, if there are difficulties, it has a more cascading effect on other areas of development. And another reason why we're focusing on this is we want to understand, and some of you I've spoken to, other people who've maybe participated previously, that sometimes these motor difficulties might really shape the type of autism symptoms that we're measuring in individuals. So in other words, if you have difficulties in social communication, it may not be that you're not interested in social, engagement. You might be really motivated, but it's harder because of the motor difficulties that you have. So I'm providing a little bit more of that background just to kind of give you a sense of where this study approach is coming from, but also noting that there's a lot of nice overlap with the ALP study. And we've really leveraged that to make sure that anyone who's signed up for either of these studies in this age range aren't doubling up on assessments because we're sharing all of this data. So with that longer background, let me go into this study a little bit more. Similar to Dr. Ludwig, there's a part A, which is in person. So there'll be a cognitive assessment, which again is a part of, in conjunction with Dr. Ludwig already mentioned within the ALP study. So it's not additional to that hour combined time, but we'll use similar data from there. There's an autism symptoms assessment, a lot of which Dr. Ludwig sort of will do as a part of her team. And then I should have mentioned, I'm the principal investigator, but Serene Wong and Ronald Lai are our two research coordinators that you'll start hearing from, and I'll talk a little bit about with the Part B. And Serene Wong will actually be there. She was a travel award recipient, will be presenting some of her work, and also be there to do data collection. She's been a really involved member of this study. But this autism symptom, some of it might be an autism assessment that we conduct as well, which will take anywhere from about, 45 minutes to an hour, maybe a little bit shorter depending on the assessment. The third sort of in-person component is our neurologic and motor room, we like to call it. So I'll be doing a neurological examination on anybody that comes in, just so you know. We have 1 to 5 if you're a part of the champion study, but any individual of all ages, I'll be doing a neurological examination. And a wonderful trainee soon to graduate, actually by the time you meet her, she'll be a fellow. Dr. Maya Ayub, who's a pediatric neurologist trainee, will also be joining us for 2 of those days, helping with the neurological examinations. As a part of those examinations, we will have a physical therapist coming in to do a certain amount of some examination as well, called the PAMS. It's called the specific kind of motor test that will get more detailed motor functioning. That was really informed by some of our data, actually, even from our paper and what Dr. Ludwig has seen, where around these areas of both low tone and high tone, getting a better sense of that maybe some of our questionnaires don't get. And then we'll again have that gait mat available. So the gait mat, for those of you who aren't familiar, is a flat sort of mat, almost meshes in with the carpet. It has a few layers, and one of those layers is a pressure sensor. So what it does is, as an individual who's able to walk or is ambulatory walks across it, it picks up really important aspects of how you walk, how variable your walking is, how wide your walking is, how your balance is while you walk. And that gives us some really nice information about gross motor function. That doesn't require somebody to follow a lot of different tasks. So that's our Part A. For our Part B, we call more of our remote, which is our caregiver interview and another motor assessment that I'll talk about. So again, this adaptive function and autism symptoms overlaps with ALPS. So you're not going to redo it if you're both in the ALPS and in Champion. And if you've started signing up, you're going to start hearing from our research team if you haven't already. We're really hoping to schedule some of those before the conference or right after the conference, because actually getting some of that information will help us better streamline what we're doing at the conference, because this adaptive function parent interview or questionnaire tells us about communication. It tells us about adaptive function, and that'll help us better understand some of the assessments we're doing in person at the conference. The other one, and I realized I thought I'd put a little image with all the images, are these wearables that we will mail to you probably after the conference at this point, maybe some before. These are like little Apple Watches or little Fitbits, and we have them in these really cute, and I'm happy to send photos afterwards, kind of socks that we call these leg warmers. The ones that go around the ankles feel just like socks, oftentimes for children. We've had really good success with kiddos being comfortable in them. They feel like socks. The ones around the wrist feel like little bracelets. And we have you wear them at home during the day. We ask for about 5 to 8 hours if we can during the day. They can be taken off for baths. They can be taken off for changing, put back on. You don't have to sleep with them overnight. But what this does is it gives us more detailed information on how a child moves, especially if that child is not ambulatory, not able to walk, right, from 1 to 5 years of age, or some of our other assessments may not get at some of their motor function. So it gives us things like, how much are you moving? What's the magnitude of what you're moving? And we're using some of these data to better understand motor function in kids with ASXL related disorders. Happy to answer more questions about that. Part C are these caregiver questionnaires. We'll send you a REDCap link, or what we call kind of an online link or survey that you can click on, and you're going to fill out information about language. It has both nonverbal and verbal language abilities. Then there's a medical background, but that's being done in conjunction with the conference. So again, it won't be a separate link that you have to refill out again. We do provide written feedback of our assessments. Similar, like Dr. Ludwig said, we do note in our write-up that this is a research assessment. It should be paired with a clinical evaluation. But we do provide it. We provide the scores that we have. We provide a short interpretation of those. And then for those families who are interested in at least a part of the study, I've met with all families with a known genetic condition. We will provide some verbal feedback as well. So we'll set up about a 30-minute call at some point by the time we get all the data together, which can be within 2 to 3 months of the conference, hopefully, maybe a little bit longer depending as we're processing this. And I'm happy to meet with any families to talk about the data that we got and answer any other questions that I can. Let me make sure I'm not forgetting anything else. I don't know if any pertains, for those of you, we do have an entire remote arm of this study, and that's how actually many members of the ASXL community have participated as well. Even if you've participated in that, we're actually asking you to re-sign up, mainly because we can do some of the direct in-person assessments that we do. Again, we won't double or overlap. We'll do things in conjunction with ALPS, but it allows us to get some of the in-person assessments that we didn't get if you participated remotely. Any questions or anything I'm missing, Dr. Ludwig or Dr. Russell? Okay. I should say it's hard to write here. It gets confused. It's 5 years and 11.9 months. So all the way up to 6. It's just 6 is kind of our cutoff. So just so you all know, in case your child falls in that realm. Okay.
Thank you, Dr. Wilson. And yeah, just emphasize that we're working so closely together to really make sure that you're not having to repeat anything if you're participating in both studies. I will mention, if you've participated in the Dr. Russell's EEG study for the ASXL1 population, you may have done some of the adaptive functioning interviews with me like a year ago, or maybe even more by now. And that's wonderful that we have that data. That's also in the registry. But we will have you do the interview again now because it's just been so much time. So much time has passed since we last did those. But what's great is that we have now both data points. And so we can actually start to look at development over time, which is really important for the development of novel treatments and clinical trial readiness. So we're actually really excited to have, more than one time point. All right. So just a few things before we finish. I know we're getting close to the end here, and we will cover all of this with you individually if you're participating, in research at the conference. So only one caregiver should come to the research sessions, and that's just because the rooms, we don't want too many people in the room. It could get overstimulating, right? But we do want a caregiver to be in the room to help support, the examiner in terms of, if the child gets frustrated, you know best how to calm your child, right? And make them happy. And so we'll ask for that kind of support. And also sometimes the examiners might say, may present something to a child and maybe they're not engaging in it. They may ask you, is this something you think they can do, right? Because if it's something that, you think they can do, the examiner may push a little bit more to try to get the child to engage to do it. But if you really don't think that it's something that they can do, they'll probably just move on to reduce the possibility for frustration, right? So those are some of the reasons why we want you in the room. We'll ask you to bring items of interest for break time to help motivate to engage and to help calm if needed. We'll ask to bring any equipment needed, like glasses, hearing aids, or other things like braces, like arm braces or AFOs, anything that they need to function. And then also if they use a wheelchair and they have a tray with that wheelchair, if you can bring that tray, I know it might be a lot to travel with, but if you can bring it easily, then we would suggest you bring it, because we might present different materials to the child. We want it to be, you know, in a place where they can see it kind of at eye level, or they can manipulate it if needed. So let's see, I'm gonna skip that part. So I think we've kind of mentioned this already, but just to reiterate, when you check in at the conference, you'll get a packet that has, you know, your schedule and kind of instructions for all the studies that you're going to participate in. You'll sign, if you're going to do the caregivers are going to do the focus group, family focus groups, you'll sign a consent at that point. But for the ALP study as well, you're going to receive some questionnaires that you can complete on paper during the conference and just drop off before you leave. After the conference, again, you may have some remote interviews with either my team or Dr. Wilson's team. And then any web-based surveys that we send you, we'll ask you to complete as promptly as you can after the conference. So I think that's it. I have here people's contact information. Any questions right now? Or thoughts?
I had a quick question. This is Stephanie McMurray. So the focus groups, is those scheduled times going to conflict at all with trying to get the research done? So like, would I be able to attend both the focus group and take my daughter to scheduled research, or would I have to do the focus group and make sure that her dad takes her to the research? Or I'm just trying to make sure I get that understood.
Yeah, that's a great question. So when we meet with you, when Rachel Northrup and I meet with you before the conference, we'll reach out soon and schedule a time. We're going to talk about that with you and really get a sense of and plan with you about that. So if you only have one caregiver, or if you really want to be the person to do the focus group and the research sessions, we won't schedule your child's research sessions during the focus group times. But we'll kind of work that out together in our individual meeting.
And also I saw that it had said that the blood draw was going to be on Friday. Is there like a time frame? Because we're going to probably not get to the hotel until about 2 or 3 o'clock on Friday, depending upon traffic. So I was just concerned that we might end up just missing that, or since they said that it was only going to be on Friday.
Amanda, do you know when they leave on Friday?
We're currently scheduled until 5.
Okay. So Stephanie, when we have our individual meeting, we can talk about that and try to schedule you as tentatively for one of the later slots that day. So that hopefully if you arrive in time that you can catch them while they're still here. And I think Dr. Russell, are there other options for families to provide samples, like when they go home? Yeah, do you want to talk about that?
Yeah, thanks. That's a good point. So if we're not able to get a sample at the conference, we can still work with you and send the collection tubes to your home. You can get your blood drawn locally, and we include a prepaid mailing envelope, and you can mail it back to us at UCLA. So we have many families who collect samples remotely too. So that's easy for us to do. We just try and do it at the conference because at least there we have a phlebotomist who's there and available to you. It doesn't have to take extra time for you to go and get blood drawn locally. But if you can't make it, again, we are happy to work with you to get it done at home.
Great. So we're at the top of the hour here. I can stay on and answer any additional questions if folks need to take off. Just want to thank you for your time. So if anyone needs to jet, I'll let you excuse yourself now, but I'll stay on until we answer any additional questions that I can help answer.